All right, everybody, welcome to committee. I think we're going to kick this off since the most important person just walked into the room. No. Welcome, Representative Ballard. Nice to have you here. No. So Ron and I don't know when it was, a couple weeks ago, we're having a conversation about Special Olympics, and we're talking about what this committee does and beyond the budget stuff. And again, so like the tours that Francie has set up and everything else, really trying to help everybody get a feel for the social services that we touch or can touch beyond just the budget cycle and the budget process. So we have another opportunity today. We're going to talk with Chris Burt, Aaron McDaniel, and John Lair, all from Special Olympics. And Ron, at some point, I didn't know if you wanted to say anything or not, or just take your hands off the wheel and let them drive.
There is no benefit to me talking to you.
That's been said about me as well. So welcome everybody, and I guess we'll start, and I guess Chris is up first, and we'll go from there. And we do have Representative Reese on Zoom or WebEx.
All right, thank you. Thank you, Chairman Buehler and the committee for the opportunity to present to you today. Most people are familiar with Special Olympics, as the organization has existed since 1960 and the state of Kansas since 1969. What many people don't know is, Special Olympics Kansas is an independent entity. We're our own 501c3. We work with the national organization, Special Olympics North America and Special Olympics International. But we serve Kansans. That's specifically what we do. And our mission is to help individuals with intellectual disabilities develop physical fitness, demonstrate courage, experience joy, and participate in a way that allows these individuals to feel true acceptance and find meaning. Because we as an organization serve a highly vulnerable population in consistently highly impactful, cost-effective ways, we've always had support on both sides of the aisles, essentially from the conception of the organization nationally and in Kansas. Here in Kansas, we serve approximately 5,000 unique individuals who on average spend half their year training and competing in sports with us. We put on about 100 competitions per year, 20 different sports, and that reach goes far beyond just those individual athletes, reaching their families, coaches, event volunteers who are part of this organization. As Special Olympics and Special Olympics Kansas have grown since the 1970s, so is our understanding of the needs of individuals with intellectual disabilities and how best to serve them. The services that we provide have grown far beyond sports. That's still the core of what we do, but there are many other pillars to the organization, how we serve these athletes. That begins with opportunities for kids with and without ID to learn about and from one another via our Unified Champion School program, which is now in 180 schools across the state. We have leadership development programs that takes what the athletes learn on the field or on the court, such as being a captain, courage, things of that nature. It helps them become leaders within their own community and their own teams. The Unified Champion School program goes beyond sports, has educational programming in the schools, leadership programming, whole school engagement that touches all the students in the schools.
Chris, I have a habit of interrupting. Can you define a little bit or describe a little bit more the Unified Champion and the Unified Schools? I don't know that I've heard those terms myself.
Yeah. So Unified Champion School program, we started in Kansas about 15 years ago. It was just in Kansas City Metro for many years, but now it's statewide. The core of that is inclusive sports. So our athletes with intellectual disabilities competing on the floor with general education students, primarily in basketball, soccer, bowling, basketball and soccer, 5v5. 3 of our athletes, 2 what we call unified partners, which are the gen ed students competing together. It's one of the more remarkable things we do because it goes beyond the court and spreads out those relationships throughout the school year round. It also encompasses leadership programs within the schools and whole school engagement. K through 12 and some colleges do programming.
Okay.
Yeah.
Right.
We have a relationship with the Kansas State High School Activities Association for Unified Bowling, which has really helped us expand. Yeah.
Okay, thank you.
Yeah, welcome. And then general advocacy support. So working with our athletes, their leadership programming, and with their coaches to help them become advocates for themselves.
All right, so beyond our sports, this gives me an opportunity to talk about where we are able to reach our athletes in a really unique way beyond what I think anybody thinks Special Olympics might be. But obviously, Kansans with IDD or individuals with intellectual disabilities. I'll use IDD obviously with that phrase, so I just want to make sure to be upfront about that. But obviously, there's a ton of unmet needs with our population in the state of Kansas. On average, our athletes die about 20 years earlier than that of the general population, which is not just because of their diagnosis, it's mainly because of the quality of life, the quality of care that they are receiving, and it is not up to par with what they need. There's a lack of equity there. So they ultimately have a higher risk of cardiovascular disease, cancer, diabetes, which ultimately leads to higher long-term healthcare costs for all of us, right? So just to paint you guys a little bit of picture, in a Special Olympics team of about 10 athletes, these are the staggering stats of health disparities. Over 7 are going to be overweight or obese, and again, this is 7 out of 10. 5 are going to be diagnosed with high blood pressure. 3 are going to have untreated dental decay, and 2 are going to have low bone density. Many conditions are completely preventable. But what is important is intervention, prevention, and also health education, right? So this is where our health programming comes in. All right, so we do have proven solutions that work on one side of our state. The other side is a little harder to reach, but these are community-based programs, all of them are. We have Healthy Athletes, which these are completely free preventative screenings to our athletes. We run these in 8 different disciplines throughout the state. We also have junior and young athletes. Young athletes is specific to 2 to 7-year-olds in developmental and motor skills, and junior athletes is going to go up to age 12. Those models are also unified in the sense that these programs are both with and without individuals with IDD, which helps with all those social aspects, obviously, as well, but also helps to boost those motor skills. We also do run Healthy Communities programs. These look like a variety of different programs, but these focus on year-round wellness aside from those screenings, those one-time moments that we're going to be able to actually be in front of them. This is making sure that they are focusing throughout the rest of the year also on these important aspects. We do also have health messengers. These are opportunities that we give our athletes to be advocates for themselves, for their population throughout the entire state. They do go through intense training to be able to then come to the state and speak in front of you guys or come see you. You might have had some visit you a couple weeks ago with some cookies and some invites. We also do have family health forums. This is extremely important for caregiver education, for guardian education, for direct support professionals, also the healthcare workforce. Some outcomes that we've already seen from these successful programs that we have run where we have more feet on the ground. We have found that our athletes are 49% less likely to experience depression, 15% less likely to eventually develop diabetes. And we internally throughout the state of Kansas have provided over 1,000 free prescription eyeglasses over the past just handful of years to our athletes as well. 300,000 workforce professionals globally have been trained through our programs. And this is also over 1,500 in the state of Kansas. With this care that we've seen and with this training that we have freely given to all of these professionals and also students in professional fields, 73% of those people that went through those trainings reported that they were able to provide better care to those with IDD, and 74% felt that they could match their communication styles better, which is obviously important when looking at diagnosis beyond an IDD diagnosis, right? Our fitness and wellness programs also have really amazing outcomes that we've seen over the past handful of years. Again, these can look like a variety of things, but mostly we're looking at boots on the ground with these specific programs. Through these, we have seen a 37% increase in physical activity among our population, a 51% increase in fruit and vegetable intake. And then with our free screenings that we offer, we really like to tout our results here because we see how important it is to actually bring our athletes directly to care. With our follow-up successes from our preventative screenings and from urgent findings, 80% of the urgent referrals that were found were placed into a place of care, whatever that looked like, primary care, specialty. And 60% also received needed follow-up then care after that initial visit, which is huge. We know follow-up care doesn't even happen with the general population, so the fact that it's happening with them is huge. Something that I do want to touch on really quick from a public health perspective, which is what my background is, which I don't know if you guys are familiar with, but it's what we call the curb cut effect, right? This was eventually made possible for those in wheelchairs, those in disabilities. That curb cut effect is obviously cutting out the curb to be able to allow those with disabilities to function in the same way that we do. But in turn, those curb cuts affect everybody else in a positive way around them too. Parents can then push their strollers into a street or up a sidewalk. Delivery workers can then also do the same thing in terms of pushing heavy boxes or whatever it may be. And so we see that in turn, these policy shifts or this support to give towards these minority populations do end up helping the greater population. It's the same idea here for medical care, right? I really want to dive into our Young Athletes program. I think this is really interesting because we do consider this such a health program. Although it does look like at face value, it is a sports program. This is focusing on those intense motor skills that are so important for young athletes and young individuals to develop. So this focuses on early childhood. Again, these programs, we like to run them for 8 weeks. We have shown that 8 weeks continuously gives us the greatest outcomes, avoiding those health disparities, obviously. We do have studies that have proven and pilots that just 8 weeks of this programming advances an individual 7 months past the point of not being involved in a young athletes program. This is motor skills, social skills, communication skills. They are also have found to maintain a 4-month developmental advantage. Confidence outcomes through this program have been amazing as well. 96% have improved self-confidence and being able to stand up for themselves, speak up for themselves, be able to be present without potentially a guardian or a parent present. The parents and teachers of this program have also reported better social skills overall, stronger learning engagement outside of these sessions, so whether or not that's in the classroom or at home. Furthermore, it just builds that lifelong health and confidence that we really need to bolster these youngins with because we see these health disparities untreated in our adult population.
Chair.
Sorry. Go first.
Okay, thank you.
Representative King, sorry.
Two quick questions. So where do you hold these events at, the young athletes, the 8-week program?
They're ran in a variety of different ways. So we have community-based and we also have school-based. So community-based, they're seen in local libraries that adopt the program. They're also seen run within our local programs. Our local programs within Special Olympics Kansas tend to be a little bit older. We are seeing a lot of enrollment in our newer population. And so we see it ran actually right within our programs as well through our volunteers.
Would a USD or a school district have to sign up to be a partner for this?
No.
Okay. So how would USD Heston be a partner in this?
Well, we do it through our Unified Champion schools. So through our Unified Champion schools, we're already in those schools. There's already an agreement through those. And so it's really easy for us to infiltrate then at that point.
And is this just a special need population that you're running through the program, or it's all-inclusive?
Is all inclusive. We do obviously end up seeing higher numbers of those with IDD, but I think it's insanely important to also have that we like to say a 1-to-1 ratio, so that's what we push for, but we do end up seeing a higher number of those IDD.
Thank you.
Thank you.
So I think Representative King asked part of my question. My question was going to be, are these unified? And I would assume that in the school base, they would be unified, not, and it's just a different delivery vehicle in the community-based setting, correct?
Correct. We do still run our community programs unified in the sense that we say unified as a pair of an individual without ID and an individual with
Okay,
ID.
all right, thank you.
Yes.
Thank you.
Yes. Wonderful. Yeah, okay. I think that was a good pause. You ready?
So, and John, if you would introduce yourself, and so we got it on the record. I forgot to do that. That, by the way, was Aaron McDaniel. Okay, okay.
So I'm John Lair. I'm the president and CEO for Special Olympics Kansas. So thanks for having us today. We truly appreciate it. Yeah, we just have a map up here kind of showing our outreach for the state. As you can see, you know, our metro areas are really heavy where we have a lot of the athletes, but we also have, in the gray areas, we have 50 counties that we're not really represented in right now at all, 50 plus counties. So we're really, you know, pushing the western Kansas part of the state. You know, 5-6 years ago, we did very little programming out there. We've really started to grow out in the Hayes area, Dodge City area, all out west. So we're really pushing out west for our athletes. But 50 plus counties currently that we do not have any athletes in right now. So that's really a big push for us with our health programming and our sports programming both together. Growing our work into these rural counties is imperative to be able to make a real impact. In particular, we need to continue to provide and or expand our health and fitness programming and our young athletes program to provide earlier engagement. Really important, Aaron talked about our young athletes program. We call it organized chaos when we go in there. But it is, you know, you see the parents that are really talking amongst each other. They don't know what to do. Parents come to us all the time. I have a child with special needs. What do I do? When they go to these young athletes events, they meet each other and they have that networking automatically. And the kids are learning skills and it really helps to grow our program for the future. But the parents networking is really an important part of the young athletes as well.
So I think I've done a and I'll introduce myself again. I'm Erin McDaniel Rotag. I'm the Director of Inclusive Health for Special Olympics Kansas. I think we've done a good job of explaining what we do well, maybe where we're missing areas of what we do well, and I think we've done a good job of explaining our challenges. I think what I really want to highlight for you guys, though, is the specific barriers and how we are addressing each of those specific barriers, and how each of these programs might also help us to expand this programming further. So, major barriers, as I'm sure you guys can understand, would be transportation challenges, especially when we're looking out west. You're lacking these organizations that provide them potentially through their Medicaid or additional services that they get. Also, we are looking at provider shortages out west as well to be able to volunteer for these programs. Our screening programs are completely volunteer ran by professionals throughout the state of Kansas, which is a great opportunity, again, to get our community involved, but also poses some issues when we don't have boots on the ground out west. Additionally, long travel distances. You are traveling long distances for medical care. Also for maybe a fresh food grocery store or a gym that they have access to, potentially that you don't have to pay high membership fees. Also, we're looking at a limited workforce in general. So this is limited partnerships, limited hospitals, limited larger medical organizations that might provide acute care, but also that preventative care, which we see as most important. So, some results then on how our programming can help address these barriers. Obviously, out west, we have an issue with limited access to dental, hearing, vision care, amongst a ton of other disciplines as well. We can address these through our healthy athlete screenings, though. We need help getting boots on the ground out there, though. We have the programming. We see that it works, and we see that it addresses those urgent referral needs where we are able to grow this programming. In addition, fewer providers that are obviously out west to be able to be trained. We would be able to help build awareness out with boots in the ground out west. This is through our family forums that we can run. This is also through our workforce training. We can infiltrate universities out west, also other medical institutions for those specialized trainings. Also, we see reduced participation in health programs overall out west. Again, we're seeing these transportation barriers, distance barriers. This is also addressed through healthy communities, healthy forums. Being able to be where our programs are, where our population is on the ground is imperative in being able to provide these programs because they are face-to-face programs, right? Also, we see that this all ultimately leads to untreated, undetected chronic conditions that will just continue to grow if not addressed. We see obviously through prevention the least or the lowest cost of care, and so that is where we would like to infiltrate the most, obviously. Ultimately, addressing these barriers is critical to improving our health outcomes for Kansans with intellectual disabilities. And so this is why we're here, and this is why we're speaking in front of you today.
Looks like John's back up.
John's back up, yeah. So yeah, like Aaron talked about, we talked about our, our challenges, our program in general. Our ask is that you help us continue the work that we're doing to empower and care for this group of Kansans, which in turn elevates our communities and the care for all of Kansans. There are an estimated 2,500 plus athletes and young people with ID in rural Kansas who currently lack consistent access to health education, preventative screenings, fitness opportunities, and healthcare advocacy supports. Our work can directly impact and provide a better quality of life for Kansans. The impact goes beyond the individual and supports families, caregivers, and communities across the entire state. We intended to ask the legislature for funding, but chose not to when the Rural Health Transformation Grant became available. We will be seeking a grant to address our state's biggest need, rural health care and early engagement. You guys, we're going to kind of open it up for questions. I was going to have Chris and Aaron kind of come back up. We can answer any questions that you guys would have of us. We appreciate the opportunity and the time.
Sure, because I'm going to sit on my hands and committee questions. I will take the opportunity if you don't. Representative King.
So I'm from out west. What do you consider out west? Okay.
In our office, we consider it Wichita West.
Okay.
Yeah.
All right. So that was not my real question.
We have basically 5 regions, and Western is basically Wichita West for our north, and yeah.
So tell me a little bit more about the food and the healthy lifestyle with food and nutrition. What are some things that you have done that have gone well, and how are those implemented?
When I first started at Special Olympics Kansas, something that I started was a project model. And in this project model, what I said is that we see, obviously, we're not able to bring our athletes in big groups to care, but what we are able to do is bring ultimately sit down with a program, ask them what they need, what they're seeing amongst their population, having time to actually see what their disparities look like, and then picking and choosing from programming that we offer. So for example, we have set Fit 5 programming is what we call it. It's their Fit 5. It's their 5 servings of fruits and vegetables. It's their hydration. It's their physical activity. That is the programming that we bring in. We infiltrate for 8 weeks there, whatever that looks like. Bringing gyms to them, bringing care to them, bringing natural grocers out to talk about the different healthy foods that they have and why it's so important that they have it. It could look like a variety of different things. Through those partnerships as well, we are also able to donate healthy food directly to our programs in that way.
Do you use Meals on Wheels or anything like that?
We don't.
Or do you do it with your own staff?
We've done it.
Do you deliver any food to the population?
No.
The population has to come to you.
Correct.
Okay, thank you.
So I I think Representative Reese has a question, and then Representative Ballard, and then Representative Steens. Representative Reese.
Thank you, Mr. Chair. I'm curious about the kind of partnerships that you have with gyms.
Great question. So specifics, I'll give you some specifics. We are running a fitness gym pilot right now, actually with a local gym out of Olathe, Kansas. It's Kansas Athletic Club. We are going into their gym for 8 weeks and going through a IDD-specific training for fitness and gym. So teaching the staff there how to interact with our population, how to safely lift with our population, how to safely teach them how to lift with our population. And then after that 8-week training, we are bringing in our powerlifting group out of Johnson County, which they already work with. And we are going to see that change of care because they have been working with that gym for the past handful of years without this specific training. We are going to observe after the training and see how those interactions change with our athletes, see what this gym is able to gain from it. This gym also, within the past year of working on us with this pilot, has decided to flip half of their gym to be completely inclusive. So they've taken out the racks, they've taken out all of their actual powerlifting equipment and have left a safe space for our IDD population to be in there without having a one-to-one supervision.
We've also, with our health program, we've helped some of our local teams get memberships at the YMCA and other places. So it's really a lack of funding on their end. We kind of help to fill in that gap. So we can really provide gym memberships for groups across the state, which is great. And it's one of our added programs that Aaron's done an amazing job doing.
Representative Ballard.
Thank you, Mr. Chair. Coaches, so you're working with people in gyms and all, but, okay, the program I'm most familiar with is the big program we have at University of Kansas. I'm a faculty member, but I'm also a basketball mentor, okay? So part of that, when we look at them, I assume there are coaches that have been working with them for a while before all of the teams show up at Allen Fieldhouse, am I correct? How do you choose the coaches? The reason I ask that question is because coaching someone in Special Olympics and coaching maybe another child that does not have a disability or something is very different. So how are those coaches chosen?
It's 80% of the time, it's a parent or a caregiver or guardian that's already invested in the program because of their own child in the program. And then we provide the training, sport-specific training, working with the athletes that goes beyond that. Probably another 10% of the time, it's a special education teacher, someone already in the field that wants to take it further with sports and be further involved. And then just a general volunteer that has a heart that wants to get involved. So we don't necessarily do the selection, we do the vetting through background checks, education, working with our athletes, and then the sport-specific training. And then a lot of what Aaron does is then the health and fitness education on top of that takes it beyond sports.
Sure, go ahead.
I want to follow up when you talk about the overweight and eating healthy and all of that is, well, that also applies to the other population that doesn't have a disability, okay? So that hasn't changed, but is the weight because they're not, I want to say not eating healthy, but they have freedom to eat anything they want because from a parent's point of view, you have a disability, so therefore you can't. Do you understand what I'm saying? So in a way, you're not as strict because your child already has difficulty coping with lots of things.
Yeah, and I'll let Aaron mostly answer this, but that's what we see, and that's where these disparities end up at because of that, and that's where we're trying to provide education, and we do provide education on the importance still for these athletes on nutrition, on physical activity, not just sports.
I think you hit the nail on the head because you do have a lot of parents that have that mindset that my child has a disability, so I'm going to let them do whatever they want to increase their quality of life, but in turn they are decreasing their child's quality of life. And this is where these family health forums are so important, and where we can really bring these entire populations together, and even why young athletes is so important, because we're able to not only have these conversations when they're already in their 30s and 40s, and we know how hard it is to lose weight, especially once we get a little bit older. I think infiltrating on those younger levels and teaching the parents that no, your individual is a self-advocate. They are not a victim. They have the ability to make these smart decisions for themselves, regardless if they live with their caregiver or live in a group home where their group home is feeding them. And I know they're not feeding them well. But it also allows them to open up the conversation of, hey, Aaron, my group home does feed me hot dogs, but I chose not to eat a hot dog, and I had my direct support professional take me and a couple other friends out for salads. I think those little interactions that we can have with them, whether it's a giant family health forum serving 500 families, or whether it's not, it's boots on the ground, driving to a team of 15 to sit down and talk to those 15 athletes and those 15 parents about the importance of allowing their athlete to be a self-advocate and not a victim.
Mr. Chair, I want to say thank you for being here. I know about them watching on, the field, and they're coming in and what they're doing, and never thought all about the things that you're doing. It's very, very helpful. Thank you for your response. Thank you, Mr. Chair.
And I was a volunteer coach for 25 years before being the CEO, so health was a big deal to me. I had a couple athletes that lost over 100 pounds by just our health education, talking to them about labels. We'd be on trips, and they'd come up and show me the label and say, hey, this is healthy. Is this healthy? They would ask the questions. But I think it's a lot about the education of our athletes and really talking to them, because they haven't had that education leading up to that. But I saw in my time in Pittsburgh, I'm originally from Pittsburgh, Kansas, saw 6 of our athletes lose over 100 pounds. And it was amazing, and it changed their life. But it was all about education and getting them into the gym and just healthy lifestyles that we teach.
It's so important. Thank you so much. Thank you, Mr. Chair.
Representative Steens.
Thank you, Mr. Chair, and thank you for your presentation today. So I wrote down a few quick things. How do you measure the impact on their lives that this makes? Just kind of piggybacking off of what Representative Ballard said.
I think a lot of it, especially at these beginning stages that we're seeing so much growth internally with our health program, I think a lot of it is qualitative. I think now we're at the point that we can pull all of this quantitative data. I think, one, it's really easy to see if we're getting referral kickbacks from these screenings and they're saying, hey, my athlete went to go see their doctor and we got this looked at. That's success in my mind. Seeing or having conversations even on the ground level with athletes and families and hearing those one-off experiences of, hey, I went through a health promotion screening. They told me my BMI is insane. This scares me. They educated me about it. I need to do something about it. And they're doing something about it.
That's great. And then if I can just have one quick follow-up. So you had mentioned other schools, businesses, community organizations that you pair with. How has the Special Olympics evolved, I guess, since was it 1968? 1968. Was it 1968? Okay. So I was, how has it evolved? Because when it first started, I think it was one thing, and now it seems like it's really expanded. So thank you.
Basically started on traditional sports. That's how we started, and that's basically our foundation still. But with our pillars of unified champion schools and our health, those are the 3 pillars that we really rely on now. We see, it's just amazing. When I started in 1992 as a volunteer, and what I've seen over that almost 34 years is just been amazing. When I was in high school, our athletes were segregated, and I might see them at lunchtime. Now, if you go to our unified champion schools, it is night and day. Our athletes have friends in the school, and you see just the families grow, the athletes grow, everybody is just positive because of this unified champion school. The health side is something we're really getting into, and we didn't really mention this. We have some great partnerships in the state of Kansas. The Lions Club helps us out. So it's hard for me to maintain a pair of glasses for 4 years. With Medicaid, that's what our athletes have. Well, we provide those eyeglasses once a year. If they need sports goggles, we provide those. Sunglasses if they don't wear either one. We have a partnership with Nike that all of our athletes get brand new Nike shoes, which is absolutely amazing. And we also have a partnership with a place in Kansas City. We provide all of the hygiene products for anybody that needs them in our program across the state of Kansas, which is just new in the last year. And the amount of products we go through is amazing because the group homes, you know, they're on very limited budgets, and we provide toothpaste, you know, Depends, deodorant, whatever is needed across the state. And we've seen such a big increase in just the numbers of people just coming and saying, hey, this is the first toothbrush I've ever had. I mean, it's just amazing. And our athletes have more confidence. But I think we're one of the only states in the whole country that do that. But I think it's very important that, you know, hygiene is very important to everybody. So Aaron's done an amazing job at helping to push that through. And we laugh at all the stuff that we get, the body wash and everything else we get. But our athletes love it, you know, and a lot of times they do not have that in their group homes and at home, so.
I've got some thoughts or some questions. You know, when, on the very last page, if I just took off the title or the description of Special Olympics, 4 of the 6 of us in this room are also on the Health and Human Services Committee. And what struck me is that the barriers that you have listed are the exact same barriers that we've been working on in Health and Human Services for the general population of the state of Kansas, with very frustrating results in some cases. And then as I was tying that to your specific ask, before I read the ask, I'm going, okay, there's got to be a tie here to the Rural Health Transformation Program. So where are you with that? Or what plans do you have to kind of dovetail into what KDHE is doing? Or I'm just curious to what your approach is at this point. If you can speak to that a little bit. Oh, yeah, bringing him in from the bullpen. All right. That's okay.
Most days I have no idea. Mr. Chairman, thank you. Ron Thornburg with Capital Strategies, and I am a proud partner with Special Olympics. And our firm, if you will allow me 10 seconds to brag, has been engaged with Special Olympics for 20 years, if not more. We have the shrimp peel coming up in a couple of weeks. Everybody's very well aware of that. And so we started representing Special Olympics this year. And part of our conversation was, let's find some funding to address those challenges. And I'm not going to repeat all the statistics, but the fact that roughly half of our counties do not have representation to provide the kinds of services and the great outcomes that we're seeing through all of the programs here. There are thousands of athletes, thousands of potential athletes who do not have access to these kinds of services, and we want to be able to provide that. You've seen the health outcomes. I'm going to focus very quickly on the screenings, because the screenings are done. I'm not sure if everybody fully understood this. When we do the athletic competitions, screenings are available. And those screenings are available for health outcomes, for dental outcomes, for optometric glasses outcomes, things that is very difficult for athletes to obtain in other locations. And so we're taking the services to the athletes. We need to start doing that for the rest of the state of Kansas that is underserved at this time. So our obligation, as John said, we originally said, well, let's go to the legislature. You've got outcomes that I think they would be interested in achieving. However, I've heard a rumor that perhaps we're spending more than we're taking in the state of Kansas these days, and it would be very difficult to obtain a budgetary benefit. Then we heard the beautiful news about the Rural Health Transformation Grants, and we believe that the kind of services that we have to offer will dovetail very nicely into those particular grants. Specifically, I don't know which one of those grants would be most appropriate for us, and that's something that we will be working with KDHE to better understand that process, but we fully intend to participate within that system, within that structure.
So absent, just not absent, separate from the funding piece, are there any other partnerships that would be kind of a force multiplier for Special Olympics. And so I'm thinking whether it's a state agency itself or Big Brothers Big Sisters, you mentioned Lions clubs. Are there other examples that become a force multiplier and enable those delivery of services? I'm just curious if they're out there, trying to understand how it's all working.
A big one's the schools, continuing to grow in the schools. You know, as I mentioned, we started off, it's only within the past 5 years we've grown out the Kansas City metro region. And that's where we're going to see, I think, it grow from in many ways, is getting into the public schools all around the state, even in rural communities where there's opportunities to do that inclusive programming, and what that will lead to create local programs and volunteer bases in those smaller communities. That's one.
I think where we found our most meaningful partnerships is where we can obviously create a relationship with whatever the organization is. And unfortunately, I found that you can't do that over email and over phone. So the best relationships that we have currently right now are with Kansas University Medical Center and their Alzheimer's department. But Kansas University Medical Center as a whole, they've helped to support us in publishing research in the past. We put on a large family health forum each year in Kansas City Metro called 321 FIT, which serves over 500 families. We do this through Down Syndrome Innovations as well. United Healthcare has been a huge partner in connecting our athletes that are currently on their plans to care, which has been a huge connection for us, both on the Medicare and Medicaid side when it comes to United Healthcare. But I think on a very lower level too, engaging our clinical directors on a volunteer level, we're trying to engage more so larger organizations out west instead of individuals. Right now we're hitting individual practices. For example, we have a podiatrist out west. He owns his own practice. He sees people from the 10 surrounding counties, and unfortunately we see him stretched too thin. And he's not able to provide the same care in that way. So I think grassroots partnerships like that out west are important. So I think obviously we want to be engaging those smaller clinics and whatnot, but also those larger organizations, which we see here in the metro and on the east side of the state. So.
Okay, I have one more question, then I'll quit. And you might have already covered it, but are there any other, I call them adult-specific needs? Because what I was hearing a lot of was tailored to the younger athletes, and even though it says working with adults on the front page, are there? I don't want to use the word geriatric, but do you have specific needs that you haven't addressed that are more targeted for adults that you haven't mentioned? I'm just curious.
All of Fit 5 and all of those programs are actually targeted towards our adult population. I think what we're seeing right now is a need to increase more of our younger population coming in, which is, I think, why we're touting this programming so much, is because we see that need. All of these programs were originally for our adults and then have been adopted for our younger population.
Perfect. Okay, I'm going to go around. Add to that?
Yeah, just real quick to add to that. We do see a need as our population is aging, and we're adjusting our sports competitions, adding bocce, cornhole, activities that are more accessible for them, fitness programming as well. Yeah, so, yeah.
Okay. Yes. Perfect, okay. Okay, committee, last chance. Any more questions? Representative Ballard.
You indicated earlier that they died 20 years earlier, right? Okay. From what I have read, part of that has to do with maybe heart problems and maybe just the toll of the disability they might have, which prevents them from exercising and things like that. How do you deal with that with parents? Because that would be a difficult thing to try to handle.
Without getting too public health medical on you, we deal with diagnostic overshadowing a lot, which is looking at our athletes at their diagnosis level and saying that all of this stuff is happening because of their diagnosis. Well, we're seeing that that's not true, which that's the medical model. So we like looking at the social model, obviously. It is not their diagnosis that is causing them to have all these health disparities. It's their diagnosis plus access plus that quality of care. So of course, you can see that if you have an individual that is wheelchair bound, of course, they might be a little bit more overweight. Yes, that is due to their condition, due to their disability. However, that is only 1% of the diagnosis. There's probably many other medical underlying diagnosis or some sort of social situation that they're in that is also causing those ailments.
Thank you. Thank you, Mr. Chair.
All right, committee. So not seeing any other questions. Thank you all very much for being here. It's been very helpful and informative for me. I do think it's in our mutual interest to stay connected on this, especially if the connector turns out to be the Rural Health Transformation Program. Great opportunity to make Kansas better. So thank you so much for being here. And with that, committee, we are adjourned. If you do have any ARPA-related things to send per our meeting yesterday, you can email those to me and we'll go from there.